This is GingerTea. I'm here again at the Apollo Theater. Now this time I'm talking to another physician by the name of Dr. Palmer. What do you represent, doctor?
I am a psychologist and I represent the Touro College of Osteopathic Medicine. We have some medical students here doing screenings, but I'm working principally with the Apollo and Dr. Smith to bring information on health to the African American community.
Okay, now I know he listed a lot of factors where there's a deficit with the African American community compared to other groups. What is the main factor in your opinion on just health and why we're at such a higher risk than other people?
Well, there's something called a metabolic disorder, which includes diabetes, high blood pressure, and obesity. That's a triangle of illnesses that when you bring them together, you get heart disease, you get cancer, you get failed kidneys, you get end-stage renal disease. So either one of those factors can lead you down a trail of chronic disease and early death. The African American community has a lot of metabolic disorder and disease.
Okay. Now let me ask you a question. When you see like older generations of African American people or just black people, and some of them live like 100 years old versus the ones now, and I work in a hospital and I see people really young dying. What do you think the comparison is, or what broke that gap on just longevity and health?
Well, I think if you look at not just individual cases, because every race or group of people has outliers, people who live very long. So that's nothing new. There's no group of human beings that doesn't have somebody who's over 100 years old. The question is, what is your mass level of survival? When you look at what is your average age of death, and if you look at African American, if you look at, for instance, I'll give you an instance. In Senegal, average length of life is 56 years old. Right. You said, oh wow, because you know here it's greater. But in Senegal, it's 56 years old. So compare African Americans, males who lived maybe around 71, 72 years old versus American white males who live 78, 9, 80 years old. There's a 10-year difference in lifespan there. Okay, doesn't sound like a whole lot, but it's different from somebody who just retired, who's dying almost already, 5 years after they retire, versus somebody who has 10 years of life to spend with their grandchildren, their other kids, before they die. So when you look at that issue, it's really a social issue that grandparents are dying much more quickly than they should, and parents of children who are in school are looking at their parents no longer being there. So that generation is gone before they know it. And that's the social impact.
So if someone wanted to contact you and just to give back or help, if you need any help, how would they do so?
We are working to try to educate underrepresented minorities and help them become physicians. The Touro College of Osteopathic Medicine on 125th and right here at 125th and Madam Clayton Powell Boulevard, 230 West 125th Street. Just contact them and let us know what you're interested in.
Again, meeting people. Harlem is legendary. This man is legendary, not just because he's a doctor, but he's a doctor who was on a mission to change the social thinkings of people of color in terms of their health. This is GingerTea here, signing out. I done.